Hello and welcome to Life and Style for Flatties. So if you've come across this channel, it means you've probably been diagnosed with breast cancer recently and you're looking for just more information. I know I was doing that. I was diagnosed with breast cancer, PR, ER, positive, August 31st, 2021, and I was 38 years old. Still 38, my birthday is April 19th, but regardless, it's still a young age to be diagnosed with breast cancer. And I think there's a lot more information out there. Women are searching to make fully informed decisions for their bodies. And so I just wanted to break down kind of the information that I learned during my whole process. So when you get diagnosed with breast cancer, you are faced with a lot of options, and I mean a lot. There's definitely overwhelming choices of what you should do treatment-wise. Do you do a lumpectomy with radiation? Do you do a mastectomy on the boob that has the tumor? Do you do a double mastectomy with reconstruction, or do you do a double mastectomy and go flat? There's all these options, and you're just kind of like, your world is turned upside down and you really don't know like what's right for you. And that's why I'm here, because I know how I felt, and I wanted just to get more stories from people who've gone through it and see both sides of reconstruction and flat. And so I really took the time to research both avenues. My automatic assumption was double mastectomy with reconstruction, because that's what was the norm. That's what's been normalized. Women getting boob enhancements, and over the years we've just always been over-sexualized, and I think women are waking up to the point where that's not healthy for our bodies, and we're gonna seek out healthier options. And hello to the flat movement. And so that's what drove me to start this channel, is because there is a flat movement going on. And the more research that comes to the surface on breast implants, we realize that it's a foreign object in our body, and our bodies are rejecting us, and women have this illness that is taking over their bodies, and they're sick for no reason. They have no idea until they started deducing it down to their breast implants. And the bodies get so full of inflammation, they don't know what to do with it. It causes fibromyalgia, joint pain, headaches, fatigue, you name it. The list of symptoms continue to go on. And I apologize if you hear my dog. She is playing in the background, and she loves her little Miss Piggy. So Mia, stop. Anyways, so back to my point, reconstruction versus flat. So reconstruction, you're gonna have a lot longer downtime, and flat, you're good to go 3 to 4 weeks, doing for yourself. What came down to me is I knew that I just wanted to return back to a sense of normalcy as quick as possible. My mental state of mind was already just, for lack of better terms, effed up. And I was just like shocked that this was even happening to me. So my whole thing was, I couldn't imagine like trying to sleep with foreign objects on my chest, nor after going through such a hard surgery like that, a double mastectomy, waking up with not only my tits gone, but expanders placed in them, and the tightness of how that would feel on my chest wall. And it's already a foreign process of such a hard surgery, and waking up and having to deal and mentally cope with something that's stuck inside your body. And, I just wasn't mentally ready for that. And I knew that I wanted to keep my body as natural as possible. And the healthiest way for my body to recover was to opt to go flat. So to break it down, reconstruction is a process that happens. It's not like a regular boob job, and you need to Google reconstructive breasts versus regular implants, because the reconstructed breasts, they definitely sit up a lot higher on the chest and they bubble out. They don't sit low and curve out or anything like that. So a lot of women, according to breastcancer.org, 43% of women end up unhappy with their reconstructed breast results. Now granted, that comes down to surgeons, and there's a lot of great surgeons out there, so don't completely eliminate the fact that you can't get or attain great breasts, but you're still gonna not have sensation on your breast area with implants. So the reconstructive process takes over a period of 12 weeks, and they inject expanders into under the breast tissue. First of all your breast tissue is removed with a double mastectomy. And so your chest wall is already gonna be tight, and then they have to place these expanders in there and then sew you up. They fill the expanders with air first during your surgery, and then you're gonna wake up to that. And that's a lot of pressure, girlfriends, on your chest. Especially if you're not used to anything foreign in your body, then that's gonna be a huge wake-up call, and that's gonna be a huge adjustment, and it's stuck inside of you. And I know I couldn't do that mentally to me. So if you think you can do it, which at one point I thought I could, but then like after I read all these horror stories, I was like, no, I can't risk that for my body. So you go back every like once a month or every so many weeks, and you get saline injected into, you're gonna have a port inserted underneath your armpit, and you're gonna have to have that port open for 12 weeks. And that's where they inject the saline into the expanders to fill up the expanders to stretch out the tissue. And then you go in for another surgery and have the implants in place where the expanders are. So it's a really drawn out process, and a lot of women struggle with their tissue even taking to the expanders. And then they end up getting a lot of infections as well. You know, there's been so many stories I've read where women, it takes like 2-4 years of their life with multiple complications of infections and surgeries, and then they just end up explanting and going flat. So it's really what you think is the most important to you. Do you want to move on forward and return to normalcy as quick as possible? Then going flat is the way for you. If you identify yourself with your boobs and think that, you know, life isn't going to be the same, it's going to tear you down so mentally and emotionally not having breasts, then try the reconstruction. But you got to know you're taking more risk with that, and going flat is putting your body first, putting your health first. You know, if you've had children and you're past a certain age, you don't really need boobs. It's just been over-sexualized in our society, and that's why we identify ourselves with them. But, you know, in all actuality, there's no need for them. They're gonna sag, and then you're gonna have to get replacement tits every 7 to 10 years. So I knew that I just didn't wanna go through that. I didn't wanna have to worry about any more surgeries. And that's why I decided to go flat. And my friends, this is what flat looks like. So as you can see, I'm completely flat, no nipples, which you don't really have the option to keep your nipples when you go flat. Nor would you really want to, because it increases the risk of your breast cancer to come back. So going flat for me, I knew I made the right decision when I woke up from surgery. I thought I was gonna do reconstruction, and I last minute decided to do flat instead. And I'm so glad. It was the weekend before my surgery was scheduled. It was on a Tuesday, and I took the whole weekend to just dive into research of, you know, the flat movement, and read about these women explanting. And these women, there's a group on Facebook which I highly recommend that you guys follow. It's breast illness and healing, breast explanting, illness and healing by Nicole. There's almost 160,000 members in that group that are explanting. And it's just because more research has evolved and they know that the implants are causing their illnesses. So that alone was really striking to me. And then I joined these groups on Facebook, Fierce, Flat, and Forward. Women sharing their flat stories of why they decided to go flat, double mastectomy to flat immediately, or they tried reconstruction and they just had these horror stories and then they ended up flat. So I definitely recommend those two groups to check out. But yeah, a little bit about my process. So this was done on October 19th and today is January 11th. So this is almost 3 weeks after. And as you can see, it's a really nice heel, really flat, smooth. That's why I wanted to go with a plastic surgeon as opposed to just like a general surgeon for my surgery. I actually went with Dr. Ben Musavi. He is at St. Mary's Medical Center. He is actually the director or runs the breast program center in Huntington, West Virginia. This is my dog Mia. She's like just so wants to be in the picture. Come on, come here, girl. So anyways, my flat journey really, it was about, 1 week was really tough after surgery, but you want to tell your physician, if you decide to go flat, you want to tell your physician that you want an aesthetic flat closure. And that just means that you want a really smooth, no lumps or bumps incision across your chest wall. And it basically is like what your chest looked like before puberty. So the downtime, the recovery time is a lot easier than the reconstructive process. I started working out probably, 3 weeks after, running and doing light stuff. 8 weeks, I started doing pretty much back to normal 2 months after my surgery, although I don't lift heavy weights. And I just feel like I couldn't imagine having a foreign object in my body. It wouldn't feel the same. I wouldn't feel normal, it would just be a really long adjustment period. And you really have to take that into consideration when you're contemplating reconstruction or going flat, because it's a mind changer. Like, it's gonna be a mental game for you, and you have to mentally and emotionally prepare yourself to not feel your normal self either way you go. Now, if you have a strong inner sense of guidance and you know yourself, you're confident in your abilities, and you know what you want in life, you know what brings you happiness, and you just have figured it out. You know that you don't really need boobs. Your body's just a mode of transportation for you. And I think those are the women who feel really confident in going flat, because they want what's best and easiest for them to recover and put themselves first to healing. Your body is yours and it's your vehicle in this life. And I think, it's really, I see a lot of stories that could have been prevented if they just opted for flat. So I just wanted to share that with you guys and, just put this out there because it really is the healthiest choice. And I apologize for any abrasiveness this might have caused someone if you didn't want to see this, but you know what? It's life. It's life. None of us, I didn't want breast cancer, but it's life and I dealt with it and I'm cancer free now. I got a double mastectomy, went flat, and thankfully it wasn't in my lymph nodes because I caught my cancer through a self breast exam. And it would be another 2 years before I had my first mammogram. So ladies, just be aware of your bodies and do self breast exams and, just hang in there. I know it's overwhelming, but I'm here if you want to leave a comment, a question, ask me about my journey or anything specific about my surgery. I'm here for you. And I am going to also start sharing some style tips. I've been a personal stylist for many years, and so I'm going to share some style advice for my fellow flatties out there. So you guys stay tuned for the next video, and I'll see you next time.